Hello future nurse, welcome back to my channel. Today let's discuss about the introduction of microbiology. Microbiology is a science of living organisms that are only visible under the microscope. There are so many organisms which are not visible with our naked eye. Those invisible organisms are studied under the microscope. Microbiology deals with the causative agents of infectious diseases, reactions to such infections, the way in which they produce disease, and the methods for diagnosis. Let's see the importance of microbiology relevance to nursing. A sound knowledge about microbes and microbial diseases is very important to a nurse in the hospital. If a nurse have good knowledge about the importance of microbes and microbial diseases, she can adopt better procedures for patient care, contribute to reduction of mortality and morbidity, and reduce the duration of hospital stay for inpatients. There are few examples to stress the importance of microbiology in nursing care, like intensive care nurseries. In intensive care nurseries, they are staffed by doctors, nurses, and other paramedical staff with special education and experience. They provide special care like use of respirators, exchange transfusions, umbilical catheters, gastrostomy feeds, etc. They take care of incubators and maintain sterile atmosphere in the unit. Obstetric units. Puerperal and post-abortal infections are responsible for a significant number of deaths due to maternal mortality. Puerperal infection is the wound infection of the birth canal after abortion or childbirth. The nurse can play an important role in helping to prevent such infections, not only in terms of flawless techniques in conduction of labor or nursing procedures, but also in protecting the mother from infections. Maternal hygiene programs should emphasize the role of a nurses in antenatal care, labor, and puerperium. Communicable disease wards. These are wards identified by diseases like tetanus wards, gastroenteritis wards, rabies wards, and etc. Patients with these diseases are admitted and are taken off. The nurse caring for these patients use aseptic techniques and adopt proper measures to prevent transmission of the infection to other patients, to visitors, or to personnel involved in patient care. Operation theatres. The nurse in the operation theatre takes meticulous care in keeping the atmosphere sterile by frequent fumigation procedures at regular intervals and checking for sterility by culturing swabs collecting from various sites in the operation theatre. She also makes suitable aseptic arrangements to see that the surgical procedures are conducted under sterile conditions. Burns units. A burn is a sterile wound initially. With a few hours, the wound gets colonized by bacteria. The nurse takes aseptic precautions to prevent hospital infection in such instances. CSSU. The Central Sterilization Unit in the hospital is a vital point to control hospital infections. Through knowledge of sterilization procedures, the nurse can greatly improve the quality of work in this unit. Post-operative units. Aseptic nursing procedures are greatly minimize the percentage of post-operative infections and can minimize the period of hospital stay. Simple operations like washing hands after changing a baby's diaper, wearing a mask while attending on a patient with pulmonary infection, and wearing a gloves while attending a labor can greatly minimize the morbidity and mortality due to infections. A nurse who understands the principle of microbiology can make intelligent adaptations of them and be successful in their professional career. Infection Control Unit. The infection control nurse functions as a clinical nurse specialist. She works in coordination with the infection control team to reduce the burden of the hospital infections. Now let's see the historical perspectives of microbiology. The study of small and microscopic organisms is called microbiology. Micros means small, bios means life. Medical microbiology is a study of microorganisms which are important in human health and disease. Very little was known about microorganisms until the development of microscopes, the foundations for which was laid by Antony van Leeuwenhoek in the year of 1683. He was the first person to visualize a small animal cues in the air using a set of lenses. John Hunter, in the year of 1767, made an extensive study of syphilis, an important venereal disease, to prove that the discharge from the syphilis sore is the source of the infection organisms. He got himself inoculated with the material and developed the infection. Edward Jenner, in the year of 1796, observed that the dairy maids who had smallpox lesions on their hands acquired from infected others were immune to smallpox. He introduced the technique of vaccination against smallpox using cowpox material. This was the first initiative of scientific immunization. Jenner vaccinations led to ultimate eradication of smallpox. Louis Pasteur founded microbiology as a scientific discipline. He is famously known as father of modern microbiology. He was a French chemist and his studies on fermentation led him to take interest in microbes. These are a few of his memorable contributions to microbiology. Fermentation. He established that the fermentation of wine from grapes was due to microbial fermentation. Sterilization. He developed various methods of sterilization like steam sterilizer, autoclave, and hot air oven. Vaccination. He made extensive studies on hydrophobia, a symptom of rabies, and discovered vaccine against disease. He also developed vaccines against anthrax and chicken cholera. Attenuation. He discovered that under certain conditions, bacteria lose their virulence and retain their antigenicity. Thus, the process of attenuation was described, which led to the development of live vaccines. In his name, Pasteur's institution was built in Paris and later at many other places. In India, Pasteur's Institute is present at Kannur, Tamil Nadu. Joseph Lister was a Scottish surgeon. He observed that the non-healing of post-operative wounds was due to sepsis caused by bacteria. He introduced phenol and carbolic acid as an antiseptic and greatly reduced post-operative morbidity and mortality. He is famously known as father of antiseptic surgery. The development of aseptic surgery opened the field of operating room techniques to the professional nurses. Robert Koch was a German physician. He had his own credible contributions to diagnostic microbiology. Staining technique. He developed staining techniques to visualize bacteria under the microscope. Culture media. He introduced culture media to grow bacteria in the laboratory. He discovered the causative agents of anthrax, tuberculosis, and cholera. He formulated Koch postulates to define a microorganism as the causative agent of a disease. He described Koch's phenomena, a hypersensitivity reaction. Koch's postulates. A microorganism can be accepted as the causative agent of a disease only if the following conditions are satisfied. The organism should be constantly associated with the lesion or disease. It should be possible to isolate the organism from the lesion. The isolated organism should produce the same disease on inoculation into an experimental animal. It should be possible to isolate the organism from the lesion produced in the experimental animal. Koch's phenomena. Koch observed that when the protein extract of the tubercle bacilli is injected into an already infected guinea pig, it evoked an exaggerated response called hypersensitivity reaction. Such reactions is not seen if the material is injected into an uninfected animal. This is called Koch's phenomena. The relation between professional nursing and microbiology started since discovery of microorganisms in the year of 1880s. This has necessitated the development of nursing procedures far more complex and refined than those used by the Angel of the Crane, Florence Nightingale. Ernst Ruska developed electron microscope in the year of 1934, which helped visualization of ultramicroscopic microorganisms. The discovery of electron microscope ushered the development of virology as a science, while the compound microscope can help visualize objects as small as 250 nanometer. Electron microscope can help visualize objects as small as 1 nanometer. Hans Christian Gram was a Danish bacteriologist. He is recognized for the development of Gram stain, which has revolutionized the understanding of bacteriology. Paul Ehrlich was one of the pioneers of antimicrobial chemotherapy. He also contributed to the development of anti-serum of combat diphtheria, an important microbial disease among children. Alexander Fleming discovered penicillin. Karl Steiner discovered blood groups, which helped save blood transfusion procedures. Sir Ronald Ross, an army physician working in India, demonstrated the role of mosquitoes in malaria transmission. Robert Gallo, in 1984, isolated HIV from a patient with AIDS. Thus evolved the science of microbiology, which great contributed to the knowledge of patient care. Tremendous progress has been made in the study of microorganisms and their influence on the health of human beings. This was possible by improved microscopic techniques and culture methods and application of Koch postulates. Recent advances in molecular biology have helped in faster, easier, and simpler method of disease diagnosis. Depending upon certain morphological characteristics, microorganisms can be listed as follows: bacteria, viruses, fungi, parasites. Let's see the scope of microbiology. Diagnosis of disease. Microbiology helps the physician to make etiological diagnosis to know the cause of disease. The physician can only make a provisional diagnosis based on signs and symptoms which may be common to many diseases. Guide to antimicrobial therapy. Individual organisms differ in their susceptibility to antibiotics. Microbiology helps the physician by giving the information about the pattern of sensitivity of the organisms to a set of antibiotics so that the physician can have a choice of the best in treating the patient. Containing the epidemics. By working in collaboration with hospital and public health system, microbiology can contribute to prompt and timely control of an emerging epidemic by identifying the causative agent. If the causative agent is defined, the method of transmission are understood, and planned interventions can be undertaken. Preparation of vaccines. Administration of vaccines to prevent disease in a healthy individual has become a routine practice. Microbiology deals with the preparation, standardization, testing, storage, and dosage schedules of various vaccines. If you like the video, please like, share, and subscribe, and also follow us on Instagram, NurseWorld25. Thanks for watching.